Hello, hi, thank you for joining me on this particular video. I'm Dr. Erica Onigbola, pharmd, Doctor of Pharmacy for close to 10 years now. I am coming back with you on how to stay focused part 2. This particular video is not all inclusive, of course. It's just my advice as a healthcare provider, a healthcare professional in the medical field. So I just want to ask that you subscribe, also like and share, leave comments and topic suggestions as well if you have them. So I just want to reiterate the fact that it's important to have a good daily living, a good nutritional diet, and also a good exercise plan in place that will help with um, an overall feeling of euphoria and activate those good neurotransmitters such as serotonin and dopamine, all of those good um, neurotransmitters that lets us know that we're doing great and that we are rewarding ourselves, and that we are deserving of those rewards. So do be in the know about that. Also, it's good to make sure we're eating vegetables and fruits on a regular basis, heart healthy, nutritious diet, such as the whole wheat products and whole wheat breads, whole wheat noodles, whole wheat items that you can cook with. And then we can substitute materials for healthier materials, from butters and margarines to um, olive oil and vegetable oils that are rich in monosaturated fats, and all of those good, nutritious ingredients that are healthy, lemons, vinegars, all of those are good substitutes that we can use. Also, non sodium salts, and make sure that we're keeping our salt levels at 1200 milligrams to 1500 milligrams per day. And also, our sugars and our carbohydrates should be kept to a minimum as much as possible, increasing also protein, also um, increasing the amount of monosaturated fats and omega-3 fatty acids, which can come from our fish products, comes from mackerels, salmons. All of those fish contain good oily skin and good oil content that we can get in our diet. And it's good to have about 3 to 4 servings per week. If not, then krill oil is a good replacement. Also, omega-3 fatty acid is a good replacement as well. Probiotics, I want to talk about probiotics. Digestive Advantage is a brand of probiotics that helps replenish lost gut flora due to illness, diarrhea, upset stomach, things of that sort. Also, probiotics are good when you're taking antibiotic therapy or you're taking medications that may cause diarrhea or a flushing of the GI tract. Then I would suggest having a probiotic for replacement and replacement back to a healthier state. Now, besides probiotics, nutrition, and exercise, and also let me make mention exercise should be moderate to intense exercising from 3 to 5 days a week of 30 minutes of intense, moderate exercise and getting the heart rate up to 70 to 80% of the max rate. Also, weight bearing exercises increases bone density, also reduces bone risk fracture. So we don't want those. So we want to make sure that we're exercising properly with weights, and we're getting our cardio uh, workout in as well, at least 150 minutes per week or 30 minutes 5 to 4 times a day. Now, also, it's important to keep with good mental health as well. That could be including getting outside into the sunlight, getting outside into the atmosphere, interacting with other people, interacting with a therapist if needed. Also, if there's a spiritual aspect of your life that you would like to explore and a little bit more, there are cathedrals and church services that are out there that can help with increasing our spiritual life and getting more in tone or in tune with our inner spiritual selves as well. And then also it's good to keep good friends, good family close by as well, and let them know what you're going through. Talk to them, confide in those that you can truly confide in on a regular basis, so that you can not only interact but have a sense of good self health, and that you can relate to other people and be transparent with other people that you can actually trust. Okay. And then also I want to reiterate education, whether you're into recreational education or just academic education. There's different types of education. You don't always have to be inside of a classroom sitting down and taking homework. You don't have to do that, but it is recommended that you increase your thinking, increase your learning, continue to learn so that you can continue to grow and continue to exercise the brain, because the brain is a muscle that needs to be exercised, stretched, flexible, in thinking, quick and witty, and also the brain helps us to think. Okay, so if we don't have a good diet, it's more likely that dementia can develop, Alzheimer's disease can develop. So we want to make sure that we're also eating good diet. Good diet affects our organ systems and helps protect us in the long term. Okay, so do be aware of that. It's also good to drink plenty of water each day to help with organ system functioning. And it's recommended to drink about 6 to 8 ounces of water in a day. It might seems to be a lot, but you can start off with 2 8 ounces per day, work your way up to as much water per day as possible. If you're dealing with heart failure, it's not recommended that you have so much fluid intake, but it is good to have great fluid intake. Great fluid intake will help with cellular functioning, reduce uh, probability of cancer and things like that, help with kidney flushing, kidney functioning. Also, it helps with cleansing the blood as well. You want to cleanse your blood, reduce chances of kidney failure and kidney stone formation. Also, you want to make sure that you're being hydrated. Your skin is a defense mechanism, it's part of your immune system functioning. So, if there's plenty of water in your skin and your skin's moist, it can protect you from allergens and pesticides, pests, all sorts of diseases. So having good skin care is very important. Keep moisturized skin, keep hydrated skin. I do recommend that as well. If most males don't usually utilize moisturized skin, but it is recommended. There's O'Keeffe's brand of hand cream ointment that is good. Petrolatum is also good. Petrolatum helps to moisturize skin for a long period of time. And then also, again, keep a, plenty of fluid in the body, plenty of fluid a day as well. And then I also want to make sure that I mentioned about hygiene, oral hygiene, eye, ears, nose, all that should be cleared of mucus, cleared of earwax, preventing conjunctivitis or red eye. Also, having a good dental plan in place, brushing our teeth twice a day or more if needed, flossing between meals as well can help with that. Good hygiene overall will affect our heart health. It'll affect our organ systems health, our blood system, circulatory system as well. So when we eat and we get germs in our mouth, all that goes down into our body. So we want to make sure that our hygiene is great as well. We're using none um, we're using, if not medicated, we're using antiperspirant uh, or even baking soda to help with cleansing as well under the arms, within the oral cavities as well. And then rubbing alcohol is a good disinfectant that is safe to use topically. So if you want an extra protection, rubbing alcohol is great as well. So I do recommend it. Also, patients who are dealing with foot care issues, athletics foot, or fungal foot, those particular items can be treated with over-the-counter medications. Over-the-counter antifungal creams are available as well. There are also pads to help with calluses and bunion removal, also corn removal as well to help protect the feet, especially for our diabetic patients. Diabetic patients can have a better life and can help have a better overall outcome by protecting their feet, protecting those nerves in the feet, because overall diabetic patients over time will develop neurological sensation depletion. And so it's best to have a good foot care plan in place, which includes washing and thoroughly drying between the toes and the foot. Also making sure that the fungal is cleared, any fungal infections are cleared, any type of irritations or burns are taken care of immediately. Also, any skin irritations that may consist of parasites, um, irritations from clothing items, from detergents, around the feet and skin should be immediately addressed, especially with our diabetic patients. We don't want to cause ulcer formation or increase ulcers, so we don't want to do that. So we do want to thoroughly take care of our bodies in all situations. I recommend also go for your daily, or not your daily, but your annual physical, your annual checkup. Women should have their pap smear done as well. They should have breast exams for those over a certain age. And then also, men should have their um, prostate exam done as well. And also have a physical done to help make sure that they're maintaining a healthy lifestyle, refrain from tobacco cessation, everyone. Refrain from tobacco use, refrain from not only tobacco use but alcohol use consumption. If we're going to use alcohol, use in moderation. It's best to not use tobacco products, just because these products are known to cause atherosclerosis, heart failure, heart attack, coronary artery disease, and also it can cause bone fracture. So do be aware of that. So also make sure that uh, medications that you are prescribed are taken as prescribed only for the indication, not to share medications, not to borrow medications. It's best to just take as prescribed on the actual prescription label. And also, if you have questions, develop a relationship with your pharmacist, with your doctor's office, nurses, staff, to make sure that you are on board with knowing what's going on with yourself and with your medications as well. So don't hesitate to contact or interact with your healthcare provider. is very critical and very important and can help you with long-term care. If your spouse is also a patient that takes prescription medications, then you can work together to help with getting those medications taken and keeping those medications together so that they don't cause any drug-drug interactions or drug food interactions or any type of detrimental effects. So I'm Dr. Erica. Thank you for joining me. I'm going to leave this information in the description box, and you can always refer back to this video if you need to. Please binge watch on all other videos that I have, and like, share, and also subscribe. Thank you for joining me. This has been How to Stay Focused Part 2. Take care. Have a great day. Bye-bye.